yourself? Have your senses kind of changed in regard to what to look out for?
Oh, for sure. For sure. You know, I think one thing that I do is, I check in with myself. It's always on my radar because I don't want to go back to that. I don't want to go back to that being irritable, not having any time to myself, not being on call all the time. I'm fine with working. I'm not saying I won't work hard, but you don't want somebody that taking care of you that is run down and sleep deprived. You want them well rested. So, having said that, I can tell when I'm starting to get run down, and I address it. I address what I need. I take self care actually pretty seriously. It's a priority. The second thing is to answer your question about recognize it on colleagues. Absolutely. I can say, hey, you're something seems out of the norm. You're not joking like you normally do, or you seem really frustrated or tired, or what's going on? You seem off, and usually that spurs a conversation. And I think sometimes it brings back awareness to the self, and oh yeah, well, this is what's going on, and X, Y, and Z, and it's just you don't have to do that. You need to take care of yourself, because burnout. I
Um,
mean, burnout. More. Sorry.
oh, no, no, no. Go ahead and finish. I thought you had paused, so I was gonna chime in. Go ahead and finish. Sorry, I apologize.
Sorry. No, I was just gonna say burnout or moral injury. We know that burnout does lead to lack of good judgment in the exam room.
Um, I was gonna ask. I know that it sounds like you're still because you could feel the hurt when you talk. And just to make the audience transparent, even for those that are going through a depressive state, that are thinking about at the suicide line, because I have been suicidal as well, and I attempted suicide, and it's a piece to it where we feel empty and there's no hope, and that's the place that we're at. I can speak from individually and experience, but just to give some a little bit of clarity. But how did this situation, and I want folks to see that are going through this and how it affects the opposite side for those that have taken their lives or those that are attempting, how it affects the survivors. What kind of traumas did this take you through, coping with you